The HOPE nebulizer is a large, high-output nebulizer that can be used for both short and long-term continuous medication therapy. HOPE can easily provide variable FiO2s. HOPE can be mixed for 1 up to 8 hours of continuous therapy. Each line represents approximately 1 hour of therapy at 10 liters per minute. HOPE can also be used for supplemental delivery of Heliox along with medication, which has been found to improve severe asthma and has been reported to eliminate the need for intubation and mechanical ventilation. The single most important factor that makes HOPE first choice for so many practitioners is its ability to deliver 64% of its medication in the optimal respirable range of 1 to 5 microns. With supplemental Heliox, it increases to 78% of the particles within the 1 to 5 micron range. Remove the HOPE nebulizer and instructions from its wrapper. The dosing chart will be on the back side of the instructions. You may want to keep them until you are certain there will be no further medication changes or therapy is discontinued. Attach the nebulizer to the source gas. You may use oxygen, air, blender, or compressor. Unscrew the reservoir from the nebulizer and mix the medications as prescribed using the enclosed dosing chart. Screw the reservoir back onto the nebulizer and adjust the liter flow to 10 liters per minute. Attach the large bore tubing to the nebulizer and the mask and observe the medication output from the nebulizer. Attach the mask to the patient and resume therapy as prescribed. Evaluate the nebulizer after 30 minutes by verifying if the medication has dropped 1/2 line. If more than 1/2 has been nebulized, adjust the flow meter down. If less than half has been nebulized, readjust the flow meter upwards. Reevaluate medication output at 1 hour, then readjust as necessary. There are 4 variables you should be aware of with the delivery of continuous medications: flow meter inaccuracies, fluctuating line pressures, reservoir fill volumes, and nebulizers. This is why initial adjustment is necessary if you need precise outputs. How to mix the medications using the HOPE nebulizer dosing chart. Physician's orders: continuous nebulizer with 15 milligrams per hour of albuterol for 3 hours. Find 15 milligrams per hour on the far left-hand column. Locate the 3-hour column at the top of the chart. Intersect the row and the column. You will find 9. This is how many milliliters of albuterol to add to the nebulizer. Locate the Fill2 number located above the 3-hour column, 75 milliliters. Fill with normal saline to the 75 ml mark on the reservoir. Reattach the reservoir to the nebulizer. Dosing charts are provided with each nebulizer on the back of the product inserts. The HOPE nebulizer may be purchased as a standalone unit or as kits for both adult and pediatric patients. Remove the HOPE nebulizer and instructions from its wrapper. The dosing chart will be on the back side of the instructions. You may want to keep them with you until you're certain there will be no further medication changes or therapy is discontinued. Attach the nebulizer to the flow meter. Remove the red cap from the auxiliary port and attach the supply tubing to a B&B 11380 100% helium H cylinder regulator. Attach an alarmed oxygen analyzer in line, 1 tubing segment away from the nebulizer. Unscrew the reservoir from the nebulizer and mix the prescribed medications using our dosing chart. Double the amount of solution mixed to accommodate the increased output from adding additional flow into the reservoir. Reattach the nebulizer. Turn on the primary gas flow meter to 10 liters per minute, 100% oxygen. Set the flow rate on the helium regulator to 10 liters per minute for 50% helium delivery, or 15 liters per minute for 60% helium delivery. Verify the FiO2 with a calibrated oxygen analyzer, and remember to set the alarms 5% lower than the prescribed FiO2. Attach the mask to the patient and begin therapy. To administer supplemental heliox with the Hope Nebulizer, you will need an 8020 8-cylinder, a B&B part number 11370 click stop regulator, a Hope Nebulizer, supply tubing, and an oxygen analyzer. Attach the nebulizer to the oxygen source gas. Remove the red cap from the Hope auxiliary port and attach one end of the supply tubing to the port and the other end to the 8020 heliox regulator on the H-cylinder. Mix the prescribed medications using our dosing chart, doubling the amount to accommodate for the increased output from adding additional supplemental flow into the nebulizer. Turn on the primary flow meter to 10 liters per minute using 100% oxygen. Set the flow rate to 15 liters per minute on the heliox regulator. Verify that you have a 50% FiO2 with a calibrated oxygen analyzer. Attach the tubing and the mask to the nebulizer and the patient and begin therapy. The Hope PEEP Kit is a combination Hope continuous nebulizer with a manually adjustable PEEP mask and accessories for use in the emergency room on patients with impending respiratory failure. Remove the Hope nebulizer and instructions from its wrapper. The dosing chart will be on the back side of the instructions. Keep them at the bedside until you are certain there will be no further medication changes or therapy is discontinued. Attach the nebulizer to the primary flow meter and set it to 10 liters per minute. Remove the red cap and connect the supply tubing from the auxiliary port to the second flow meter. Mix the medication as prescribed. Turn on the secondary flow meter to 5 to 15 liters per minute, depending on the approximate minute volume of the patient. Attach the mask to the patient. Slowly adjust the secondary flow meter until the reservoir bag remains adequately inflated during inspiration. Adjust the head straps to eliminate any air leakage around the mask. Attach a manometer to the mask manometer port, then slowly rotate the PEEP valve knob until desired PEEP is achieved. Then remove the manometer and cap the port.